The testing site is serving several counties around Tompkins. It is staffed by Cayuga Health personnel, primarily nurses and med techs and LPNs and other individuals who are not doing their normal job because of mandate or our situations. The entire medical operation, although we fold in under the county, is provided by Cayuga Health. We do utilize national labs, but we collect the sample, obviously, process it, receive the results, and then communicate them through the health department to the patients who were sampled and tested. We have contacted retirees or medical professionals who have separated from the hospital or went into another career but still maintain a license, and that is in keeping with the instruction and the request from the governor in anticipation of the large number of COVID patients who will need care throughout the state. So yes, we have retirees, we have individuals from the community who are capable of rendering care, and we are tabulating them and making sure that they're available for recall. I think we will see an increased number of cases. We've begun to see an increased number of positive results. That is a phenomenon known as community spread. We are keeping track of and enhancing our readiness and capability at the hospital. I think we will see an increased number of patients needing hospitalization. Thankfully, we're not seeing that at this point. But again, we're typically days to weeks behind what New York is experiencing in terms of the rate of growth of cases. And thankfully, we have a smaller population and a better per capita bed capability in terms of hospital resources. Right now, we've got a fantastic capacity. We are not seeing any COVID patients requiring ICU level care, and we'll be ready to respond to a great extent. And we are resting and preparing our staff to use PPE properly, and I have no doubt they'll rise to the occasion. It's a horrible crisis. It's impacting every facet of our society. So I think we'll look back and realize how this affected every facet of our life. Medically, if there's a silver lining, it's forcing us to transform in interesting ways. There's definitely a sense of solidarity among the staff and the clinical workforce at the hospital. Adoption of things like telemedicine, emergency preparedness, appreciation for public health and epidemiology, hand washing, the concept of social distancing. These are all things we'll look back and realize that in 2020 was the year that these all became things we had to learn about and appreciate. Many parts of the state are struggling with the incapability of offering sampling and testing to its citizens and its residents. And so I think this is a great resource, and this will help us understand where we stand in the fight against COVID. So a word of thanks to all the clinical staff who stood this very substantial effort up on short notice. So I'm proud of my team.